I'd like to welcome everybody to the second annual Symposium on Children. I'm Laura Justice. I'm the Executive Director of the Crane Center for Early Childhood Research and Policy. We're going to go ahead and get started with the program. I know that a lot of people are still eating and getting their bearings, and it's fine if you want to move around and get more food while it's still out. But I want to welcome you to our second annual Symposium on Children. This is a thematic event. We're always focused on early childhood and young children, but we like to take on a contemporary and important topic each year. And our focus this year is on young dual language learners. And before we begin and move forward through the program, I do want to say thank you to a few folks who have worked very hard to get us to where we are today. Starting with Melanie Tracy, who's working as she's assisting the Crane Center with events coordination. And I'd also like to thank the entire Crane Center staff. There's a lot of people who came over here today to help out. And I'd also like to thank many of our graduate students and scientists who presented posters here today and shared with you the work they're doing. And I'd also like to thank Millie Gort, who you'll hear from in a second, who helped guide the thematic focus of this work as one of the leading experts nationally in bilingualism. So my job today is simply to welcome you. We are thrilled at how many people are here today. The core mission of the Crane Center is to bring together researchers, practitioners, and policymakers, and we've done that today. And so I have to thank you for coming out and representing the various constituents or organizations that you work in, a school, a university, a school board, and so on and so forth. Let me share with you a little bit about the program. What we're going to do right now is Millie Gort will introduce the topic and our two speakers. We've brought to you two of the top scientists in our nation addressing dual language learners. So we'll have two formal scholarly presentations today, followed by a break. And when we come back after the break, we have a panel of 5 individuals, and the panel is designed to transcend research, practice, and policy. So we have 2 school principals, we have a researcher, we have a county commissioner, and we have a state senator. And so we transcend research, practice, and policy, and what we'll do is hear their reactions to the topic that we're addressing today. So what I'd like to do is turn over the mic to Millie Gort, an associate professor in the School of Teaching and Learning here at Ohio State University. We stole her a few years ago from the University of Miami to bring her all the way up here to our 4-season climate because we want people like her here at Ohio State to bring expertise in bilingualism. So let's all welcome Millie Gort.
Thank you, Laura. This is a privilege for me to get to introduce 2 of my academic sheroes. So happy that you're here with us and to share your expertise and some of your latest thinking on this really important topic. Yesterday, I had a chance for a few minutes just to provide a context of the topic and to define this population that we're here to think and learn some more about. And so just as a very brief sort of recap of that, dual language learners, for those of you that maybe have heard the term or other terms that are related to this population, are children growing up with 2 or more languages. It's a broad definition because this term encompasses many, many children. The label doesn't mean that these children have necessarily had equal or similar exposure to the languages that they're growing up with, but it simply means that their experience and the way that they live the world is through 2 or more languages. So that's an important sort of starting point for us to think about when we think about the population that we're focusing on. And we're particularly focusing on the youngest of that population, so young dual language learners in pre-K and early grades. So I will begin with Dr. Peña will be our first speaker. And I'll read a little bit about her work, but she most recently has garnered attention for a new assessment that has been piloted and is being used widely now, and it's an amazing bilingual approach to trying to disentangle what kids who are growing up with two languages, what typical experiences and what their typical development looks like from children who might have specific language impairments who also are growing up with two languages. And so she and her team at UT Austin are producing these amazing tools for us to better be able to understand what these children's current level of functioning and current level of performance in the two languages that they're growing up around looks like. So thank you for all of that work that you're doing. But a little bit of background about Dr. Pena. So her research focuses, as I mentioned, on differentiating the meaning of language impairment from language difference by developing protocols like the BESA that I think maybe we'll hear a little bit about today. And using dynamic assessment. She also focuses on learning impairment in children from diverse linguistic backgrounds and how they learn new language skills. She is currently working on two large NIH-funded projects. The first, in collaboration with some colleagues at UT Austin, is a diagnostic markers of language impairment in bilingual children. So there's additional new work coming out, which is very exciting. She's very productive. And the second one, also in collaboration with a colleague from UT Austin, is called Phenotype Assessment Tools for Bilingual Children, whose goal is to develop an upward extension of the BESA, the Bilingual English-Spanish Assessment, which is the one I referred to earlier that is super exciting and getting picked up and used across the country and probably beyond. So without further ado, I welcome Dr. Liz Pena.
Thank you for having me. This is really exciting to talk to such a large group of people, and I'm going to be talking today about language difference and disorder. I started out as a clinician. I'm a speech language pathologist by training, and I started out by working as a clinician, and a lot of the questions that came up were around this issue of, does this child have a language difference or does this child have a language disorder? And so that's been kind of the impetus of a lot of the applied work that I do in this area. So this kind of represents a journey of about, I hate to say 30 years, in working in the field and working with children who are bilingual. I'm originally from the San Francisco Bay Area where there are, is it loud enough? Do I need to talk? It's because I'm shorter, a little shorter than Laura. I started out working in the Bay Area where there are hundreds of languages, and so this issue came up over and over again. But my focus, but now I have to stand way over here. But my focus has really been more on Spanish-English bilinguals because we're able to assess them in both languages, and hopefully from understanding what Spanish-English bilingualism looks like and what second language looks like, second language learning looks like, we can start to generalize to other language pairs as well. Okay, that is working. I do want to disclose that I am an author of the BESA, and a lot of the examples that I draw from come from this. So I do get royalties. I'm not getting rich on it though. But you know, every once in a while I get a check and take my family out for a nice dinner. My collaborators, who I also want to acknowledge, are Lisa Vidor, who's at UT Austin, Vera Gutierrez-Collin, who's at San Diego State, Aquiles Iglesias, who is now at Delaware, and Brian Goldstein, who's at LaSalle in Philadelphia. So people start moving around. But let's start out with what I want to do today is talk a little bit about demographics, and I think you're well aware of what some of the demographics are and some of the changes across the US and across different states in terms of the growing bilingual population. And then think about challenges to clinical decision-making with examples of what do we need to think about when we're developing appropriate clinical measures for a bilingual population. So a tiny bit of the demographics. map of the U.S., and you can see that in places like California, like Texas, Florida, the typical states, there are large numbers of ELLs. The majority of them are Spanish-English bilinguals, so about 20% of the school-age population, as you may know, use English as a second language or are considered dual language learners. Among those, 80% of them speak Spanish as their home language. And so you can see that there are large pockets of bilinguals across many of our states. And in places like Ohio, even though Ohio has a smaller bilingual population, it's still in the upper half of what we see in the US. So it's number 24 in terms of the size of the bilingual population, and it's growing. So you can start to see these patterns of growth in this population. One of the challenges in clinical decision-making is that we've typically compared how children perform to a monolingual standard. And when you test bilinguals against a monolingual standard, it may be that sometimes kids make errors because of learning English as a second language, or it could be that they're making errors because they really have a language delay or a language impairment. And so that's something that I think has been quite a challenge in our field. So the kinds of questions that I'm thinking about are, how do you develop a way to tell the difference between a true language impairment versus what are the outcomes of living your life half in one language and half in the other language? You know, how do the two languages interact, and what do you do about that? How can you tell the difference? So I want to start out with a definition, and this is the definition of what we call specific language impairment or primary language impairment, and I call it plain old language impairment or a language delay. And this is a language disorder that delays the mastery of language skills in children who don't have hearing loss, don't have any other developmental delays. So there's no reason for why they would have a delay in language, but they have a real hard time learning language. So that's the basic definition of a language impairment. A bilingual language impairment is the same thing, but it should not be an effect of second language acquisition. And that's part of what we include in IDEA, that you can't identify somebody as having a disability if it's due to their not having enough exposure to English or not having enough exposure to academics or any of those kinds of issues. And so that's a critical aspect. And language impairment should affect both languages. But there's a high rate of misdiagnosis, partly because second language learning looks like language impairment. When kids are in the process of learning a second language, even when adults are in the process of learning a second language, they make errors that are not unlike errors that children with language impairment make. And so some of those things are leaving off, plural S, leaving off past tense ED. In Spanish, it's things like mixing up articles. If anybody's tried to learn Spanish as a second language, getting down that gender number system is really, really hard. And that's what's hard for kids with language impairment too. And first language loss, as kids are in the transition from learning one language and starting to speak another language, they also start looking like kids with language impairment. So how do you know if it's language loss? How do you know if it's a language difference? How do you know if it's a true language impairment? And so we look at different areas. So we look at vocabulary, we look at grammar, and we look at speech. So in the vocabulary area, children with language impairment have weak vocabulary systems, and they have a lack of semantic breadth or vocabulary breadth and depth. But in children with language impairment, it's weak, but the number of words they know or the kinds of things they can label or recognize is usually within normal limits. It's more categorizing things or naming what goes with what, or using descriptions or using words that are associations with other words. So that vocabulary network is difficult. But kids who are bilingual kids with normal ability have some shared concepts across their two languages. But lots of times, not everything they know in one language do they know in the other language. So if you only test a child in their vocabulary in one language, they may know some things, say in Spanish, that they don't know in English, or they may know some things in English that they don't know in Spanish. When I first started out doing this kind of work, one of the things that I learned is that you had to test kids in their dominant language, in their better language, or in their home language. And it was assumed that everything that they know in that home language is what they know. And what they know in their second language is a subset of what they know in their first language. But that's not necessarily true. Think about like a typical day of a child. If they're at home speaking a home language, they're going to learn vocabulary associated with their home language in that language. But the kinds of activities that go on at school aren't the same kinds of things. And so they may learn different words in English at school. Okay, and so you have to have ways of putting together their two vocabularies. So lots of times children with typical development also show low vocabulary if you only test them in one language. If you put the two languages together, you tend to see vocabulary numbers that are close to or very similar to that of monolingual norms. But we don't always do that. We just assume that their better language subsumes everything that they know, and that's not necessarily what's going on. In a lot of the kids that we work with, really young 3 and 4-year-olds, lots of times they know everything in Spanish, and then they fall apart when it comes to like the school kinds of things, so colors, numbers, shape, size, prepositions, which are harder in Spanish, all are known in English, even if they have really, really limited English proficiency. So lots of times they know those things, but they know them in English. Okay, what about grammar, morphosyntax? Children with language impairment have a hard time with different aspects of grammar. So in English, it's things that mark tense, so past tense ed, progressive ing. So those things are hard for kids with impairments. The passive form, plurals are hard. In Spanish, it's different though. And so, again, when you're developing tools, you can't take what's hard for English and expect that to be hard in another language, because different languages are structured differently. And so for Spanish, direct object clitic, like lo, la, so dámelo. So the lo refers to that, so give me that. The lo is really hard for kids to produce. They will mess that up, they might delete it. It's a hard aspect of Spanish language acquisition, and it's hard for kids with impairments. Articles, so the dog, because in Spanish you have to mark number and gender, so you have to say whether it's female and how many there are. It's a hard system for kids to learn, and kids with impairments have a hard time with that. And also the subjunctive form is hard. So those are things that are hard for children with language impairment. What about kids who are learning a second language or losing their first language? Guess what? It's the same stuff. The same things are hard for these kids, and so that's what makes it really complex to figure out, is it a language difference or is it a language disorder? Let's think about another area. So we're going to think about speech, and this isn't necessarily my area, but I have wonderful colleagues who teach me about this stuff. So this is based on work by Brian Goldstein. But kids with speech impairment have difficulty learning the sound system. So they make errors in their pronunciation that will signal to somebody, oh gosh, that's a speech error, that's a problem. Kids have a hard time with later developing sounds and with low frequency sounds. But children learning a second language may also have problems with those same sounds, especially sounds that are not shared between the two languages. So in Spanish, how many vowels are there? 5. In English, how many vowels are there? vowels. How many vowel sounds are there? Yeah, there vowel sounds. Depends on the dialect, right? I always say I'm from California, it's a one vowel system. But but in English, we have something like 12 to 14 vowel sounds, okay? So the way you divide up your sounds, so you have I and E and E, and in Spanish, there's one E, right? And so those sounds go to those words, and that's how you can come up with really creative words when kids are using English as a second language. So their first language might interact with their second language might interact with their first language. So it sounds like kids are hard to understand, but you don't know if that's a speech problem or not. The other factor that contributes to misdiagnosis is this idea of dominance. And again, I said that when I first got into this, I was taught that you figure out the child's dominant language. And so there's different ways of determining the child's dominant language. We can ask when they first started learning their second language, and that's an indicator of how well they should know their second language. We can also ask how much exposure kids have to their first language and to their second language. So what's their daily life like? What do they know in, how much exposure do they have in English on a day-to-day basis? How much exposure do they have to Spanish on a day-to-day basis? And that should be pretty indicative of how well you should expect children to know each of their two languages. But it's not as straightforward, unfortunately, as you might think, because kids don't just jump into being dominant in Spanish one day, for example, and then being completely dominant in English the next day. It's a developmental process. And so what we're finding is that across different areas that you're learning, you might show growth faster in your second language than in other areas. And so it looks to us, but we have to test this out, of course, that kids get a good handle on the speech system, so on the sounds of their second language, relatively early. One reason is that the two languages overlap. And then kids start getting a handle on the semantic system or the vocabulary system in their second language. And grammar lags behind. Grammar is really complex, and so they might be looking dominant in English on vocabulary, but their English grammar is terrible. But their Spanish grammar is still good. Okay, and so you might have what we're starting to call mixed dominance. And so this is hopefully, can you see the red bars? Okay, from my angle, they've disappeared. And so on the left-hand side, these are the children who have more than 60% English exposure. So on a day-to-day basis, they use and hear English at least 60% of the time, from 60% to 100% of the time. And they only hear Spanish from 40%, from 0 to 40% of the time. And you can see that most of them are dominant in English in everything that they were tested on. Speech, vocabulary, grammar. But a small percentage shows mixed dominance. So they were dominant in Spanish on something, okay? The kids on the right, it's the same pattern. Those are the Spanish dominant kids, or the kids who are mainly exposed to Spanish. A small percentage of them are starting to learn English, and they're starting to show dominance in at least one of those three areas in English. And the kids in the middle, these are our 40-60 kids. These are kids who are balanced bilinguals, but they're only equally proficient in all those domains. Only a small number of them are equally proficient in Spanish and English, even if they present as having balanced input. So the large majority of them, so that's the big red block, shows mixed dominance. And so most of our balanced kids actually show this kind of profile. And this is based on 600 children that we tested. So to give you a little bit more detail, at the bottom here, these are child by child bars. And so it shows you kids who are dominant in English across all three things, and then at the end there, you start to see these kids who have mainly English exposure having some things where they're better in Spanish and not in English. These are our balanced bilinguals. So we have every combination of Spanish-English dominance in their performance. And then these are our Spanish, more Spanish-exposed kids. And there you see movement toward learning more English or having more dominance on English tasks. So the dominance is going to vary by domain, by what you're testing, and you have a lot of kids with mixed dominance. And this makes it makes from a clinical perspective, it makes it really challenging. From a research perspective, it makes it really interesting. The other thing that we have to think about when we're testing or when we're getting ready to develop assessments for bilinguals is we want to think about the test language characteristics. So we can't just take a test, and this has been something that we've done, at least in my field, and I think in a lot of other fields as well, so you take a test and translate it. And that's not a very good idea because you're not always capturing what's important in that language. And some things are hard to translate. You might also change the difficulty of something. So I mentioned earlier, for example, prepositions are pretty easy in English. They're really hard in Spanish because they have to occur with verbs and you have to use them in a phrase and they're interpreted based on context. So that's what makes them really challenging for Spanish speakers and later developing. Even though, in preschool we expect kids to know their prepositions in English, but in Spanish they may still be in that developmental process. So what are the characteristics of the language that's important? This is the Spanish and English phonetic inventory, and all those symbols are the phonetic symbols. So how many of you know IPA? Okay, there's a good majority of you who know IPA. So each of those symbols represents a sound. And so it doesn't matter whether you know what those symbols are or not, but just squint and tell me what you see. What are the differences between Spanish and English? Anybody? Fricatives. English has a lot more of them. So those are the sh, j, sounds that don't exist in Spanish. Okay? So those are some of the differences that you're going to see between the two languages. Okay? This is an inventory of the syllable types, and so the syllables, again, have different kinds of structure. So in English, we can have we can pile on consonants like in the word strength, right? So you have 3 consonants at the beginning, 1 vowel, and then 4 consonants at the end. You don't do that in Spanish, right? Those, you can see that from trains, from like the 2 consonants, 1 vowel and 2 consonants on, that doesn't exist in Spanish. Spanish mainly uses consonant vowel combinations and then a few consonant vowel or consonant vowel consonant kinds of structures in their syllable. That's going to make a difference in terms of what kids are able to pronounce. If they don't have that in their inventory and they're not used to putting, like an S, a T, and an R all together into a cluster because it doesn't exist in their language, then that's going to be more challenging for kids who are learning English as a second language. And so that's probably developmental, but kids with language impairment have those problems too. So you have to think about syllable types. Vocabulary, again, you have some distribution between 2 languages. You have contacts by language interactions. It's influenced very heavily by children's experiences and by their culture and what they're exposed to. In one of the studies, we looked at different ways of eliciting vocabulary. So we looked at things like similarities and differences. So can you tell me how these 2 things are similar and how these 2 things are different? And linguistic concepts, and those were things like school concepts, number and shape and color. Characteristic properties, so describe this thing. So we wanted to get beyond single word vocabulary. We felt that single word vocabulary tests are not very good for identifying impairment in kids, and they're so experientially based that we didn't want to bias what we did. We wanted to come up with ways of eliciting what children knew and understanding whether they had good vocabulary organization and good vocabulary networks, rather than knowing a word list that we determined ahead of time. We asked them to categorize things. So tell me all the food you know in like the category of fruits. It doesn't matter if you say apple and banana or pear versus, mango and papaya and guava, right? It just matters that you know that those things belong in the fruit category. Word associations is another one. So tell me something that goes with table. Chair, right? Tell me something that goes with, so do you have those associations? And then what do you use things for? And so we found different patterns of performance for children in English versus Spanish. When we tested monolinguals, we saw really similar performance within language. So things like similarities and differences and categorization was more telling of ability for English when we were testing kids in English and when we were testing monolingual English speakers. And for Spanish, things like linguistic concepts and functions of objects were more telling about language ability when we were testing children in Spanish and when we tested monolingual Spanish speakers. So the way that kids learn to organize their vocabulary might be a little bit different, even though we started out with the similar numbers of items in each of these things. Again, this is another way to show some of the same ideas that I've been talking about, but things like articles, progressive, subjunctive verbs, direct object clitics are hard for Spanish, and then things like possessive, third singular, some of those grammatical forms, the copula, negatives, passives are hard for English. So we want to target different things across the two languages when we're looking at grammatical development. So how do you use this to develop appropriate measures? What we did is we started out using kind of this item analysis approach where we tested tons and tons of items and looked at children with and without language impairment, looked at kids across age, and then looked at children with different levels of exposure to English and to Spanish. We wanted to select items that really were hard for kids with language impairment and not hard because they didn't have enough exposure. So we started out, to get to the point that we're at now, we started out with, 200 or 300 items and tested, a few hundred kids, and took this approach where we looked at groups of children with impairment or groups of kids that, teachers and speech pathologists and clinicians thought had language impairment, and then we compared systematically item by item to retain those items that best helped us identify impairment. The other thing that we need to think about for identification of language impairment and identification really of other kinds of disabilities as well is whether or not the test that we come up with tells us what we want, tells us what we're after. In the case of identification of language delay or language impairment, we're really interested in how accurately that test tells us whether the child has language impairment or not. So we look at this question of classification accuracy. The question is, can we increase true positives? So can we say these children that we know that have language impairment, does the test accurately classify these kids that we know who have language impairment with language impairment? Okay, so that would be increasing our true positives. And then we also want to increase our true negatives, make sure that kids who don't have language impairment aren't misclassified as having language impairment. Because I think we get a lot of that at different ages. What I've seen in terms of the data, at the preschool age, we tend to have more under-identification now. I think we've seen this kind of pendulum swing back and forth. Probably 30 or 40 years ago, we had more over-identification of impairments in bilingual populations. My latest read of some of the stats are that we have more underrepresentation. So lots of times we think, well, that child still needs a little bit more time to learn English, and then we'll test them to identify them. So we see this back and forth. But by first grade, second grade, we see over-representation of kids with language impairments. And a lot of this is, based on, there are a lot of differences by states and by regions and by counties and so on. But we want to develop measures that really increase how well we can identify kids. That basically says the same thing. So I'm moving on. So we think about these as sensitivity and specificity. So sensitivity is how well do we identify kids with LI or kids with language impairment as having language impairment, and then how well do we identify kids with typical development as having typical development. So I've done a couple of studies. I'm going to go through these. Well, I'm going to give you some examples of how we've done this. These are some data based on some speech, some kids that we tested in the area of speech. And the kids who are highlighted in red are those who we thought had language or speech impairments based on language samples. So we collected language samples and sent them to Brian, and Brian transcribed them and identified kids with language impairment, or Brian's students transcribed them. And then we had, right? And then we had kids who didn't have language impairment. And we gave them the speech part of our test. And if you look at children only in English, so that's what the blue bar shows, then we capture most of the kids who have speech impairments, but we also identify another group of kids inappropriately as having speech impairment. If we test them only in Spanish, it's the same kind of thing. So we pretty much pick up on most of the kids who have speech impairments, but we do it at the cost of over-identifying kids who have speech impairment as having speech impairment when they really don't. When we combine the two languages, though, and use that combined approach of low in Spanish and low in English, then we do the best job at classifying the kids accurately. And so this is an approach that we're starting to use to address that question of, do you test in Spanish? Do you test in English? Which is their better language? Lots of times you just don't know. And even if you get like that really careful interview, if they're using both of their languages at least 30% of the time, and that's a big chunk of kids, it's really likely that you're going to have this mixed dominance. So you're not going to be able to just test them in one language and have an accurate answer. And so if you combine them in this way, then you can increase your accuracy. So these numbers look like this. So the sensitivity and specificity numbers are the ones to look at. So we have good sensitivity and specificity in Spanish, good sensitivity and specificity in English, but we do the best job when we combine the two languages. This is what semantics looks like. So semantics is our best items among, categorization and linguistic concepts and similarities and differences and those kinds of things. And again, we see similar patterns. So if we test them mainly in Spanish, I think I mixed that up or I moved my axes around. But if we test them only, in Spanish, then we over-identify kids. If we test them only in English, we also over-identify kids. But if we combine the two languages, we do the best job at not over-identifying and not under-identifying either. So that speaks to this idea of combining the two languages. Again, we do a pretty good job in Spanish by itself, English by itself, but when we combine the two languages together, we get the best sensitivity and specificity. The last one is looking at grammar or morphosyntax, so it's the same thing again. If we test them mainly in one language, then we over-identify. And we over-identify a lot because grammar is hard. If we only test them in one language, again, we over-identify. We just identify different kids. And then if we test them in both of their languages, we do a pretty good job of reducing error in our classification. These are our sensitivity and specificity statistics. So again, when we're combining the two languages, we do the best job. This is a pretty graph, I think, right? But it shows the same thing again, but this is combining morphosyntax and semantics. And so here, again, by combining morphosyntax and semantics, we do a pretty good job of identifying the children who really have language impairment. Morphosyntax is harder, so that really does most of the work, but we're doing pretty well. What I want to finish with is showing you a quick case study of thinking about language difference or language disorder using some of the tools that we have started to develop. So here we have two kids, child 1 and child 2, very creative names. And one of the things that we did is we asked parents using like a little inventory called the Inventory to Assess Language Knowledge. I came up with this title, I can never remember it. Really careful questions about their vocabulary and speech and sentence production and grammar. One of the things that we found in our early work is that we would ask questions like, are you concerned about your child's language development? And we would get yes. And then we would ask, so tell me about what your concerns are. Well, I'm concerned that they're not very polite. They don't shake hands when they, are, in a room with a big crowd and they're very shy. That's not telling me what I want to know because I want to know about their speech and language development. We might also get no, and then later on they'd say, yeah, they're not very good. They make a lot of errors doing, this and that. So we decided that parents were probably aware of what was going on, but maybe we needed to ask in different ways. And so we came up with a way of just asking in more detail. So we asked things like, tell me about your child's vocabulary. Do they use a lot of words? Do they just use a few words? And we ask about this in every language. Tell me about your child's pronunciation. Do they say things like, do they leave off syllables when they're pronouncing long words? And we give them some examples of that so that we can really get at what they understand or what they can report about their child's Spanish and about their child's English. We did find that Spanish-speaking parents are not very good at describing their child's English. Big surprise. And we also found out that teachers are not very, even if they're Spanish-speaking, tended not to be very good at describing the child's Spanish. They were great, though, at understanding and describing children's English. And I think that has to do with how we're training teachers, that we're training them to focus on English and English language acquisition, not necessarily on Spanish and Spanish acquisition. There's always exceptions to these, but those were the tendencies. The other thing that we discovered is that parents, the scores that we got from our parents were more correlated to vocabulary, and the scores that we got from teachers were more correlated to children's morphosyntax. So I think they're paying attention to different things. And so if you put this all together, you can get a better picture of what's going on. So I really feel strongly that we need to be asking parents and teachers about what kids are doing to get a good picture of what kids know. But here we have these two kids, and it looks like there are some similarities between the two, but child 1, I think the mom is indicating difficult Child 2, the difficulties in grammar are more in English, but maybe something in Spanish. These are scored on a 1 to 5 scale. So these are the averages. They're not that different. These are some of their test scores. So both of these kids were given the test of narrative language in English, and they're scoring 2 standard deviations below the mean. So these are significantly low scores. We also gave them the test of language development, and again, these kids are very low in this in English. And this is really just to illustrate what kids are doing in English. And one of our questions has been, well, can we do some testing in English that's indicative of what kids know when they're in the process of learning English as a second language? And I think there are some things we can tell, but maybe not with these standardized tests. And then here I've given the BESA results, and you can see what the patterns of results are in kindergarten and in first grade for the 2 kids, but I have a better picture of that. So this is both kids, not just child 2, but child 1 in first grade, if you look at that XY graph, you can see that they're low in both of their languages, in morphosyntax and in the semantics area. Child 2 isn't. So they're strong, they're pretty strong in semantics in both languages. In morphosyntax, they're stronger in Spanish than in English, but their Spanish score is within normal limits. So I would argue that your first child is a child that we probably need to follow up on and probably need some intervention. And child 2 is functioning within normal limits, but if we'd only tested him in English, or her in English, then we wouldn't have a full picture of what they're able to do. Basically, in thinking about language assessment for bilinguals, I think some of the lessons that we can take home are we want to be sensitive to the language that we're testing. We want to focus on what's hard for that language for whatever it is that we're looking at. And we want to make sure that we're using instruments that are accurate for the purpose that we're using them. Am I supposed to take questions now or later, or maybe 2 questions now? And thank you. I wanted to show you a Texas Longhorn. Because I saw cows here, but they don't look like those. So I'm told I can take a couple of questions now if you'd like, or yes. Uh-huh. Yes. Mm-hmm. Right. Yeah. Mm-hmm. Yeah. Yeah, no, that's a great comment, and we see exactly that, and we see it occur. We see that affects vocabulary, especially because they know vocabulary words for like the university setting for for English, and then home setting in Chinese. So we see exactly that. I have one example of a category generation task that we did, and so we asked kids to tell us what kinds of food they eat at a birthday party. And we asked them in Spanish, and we asked them in English, and we looked at the top 3 words. And I think this illustrates this issue of you function in 2 worlds if you're bilingual, and those 2 worlds are different. But this was the same topic. It was a birthday party. In Spanish, the top 3 words were Well, let's start with English. The top 3 words in English were? Cake. What do you eat? Not what do you open? This was in Texas, okay? So, hamburgers and hot dogs, okay? What you eat at a birthday party in Texas, okay. Same kids. Yeah. Same kids, birthday party in Spanish. So, pastel, cake was number 1, and then what else? Was arroz, frijoles. So, cake, rice, and beans. And in English, it's hamburgers, hot dogs, and cake. So, it's kind of, you almost see that those associations with their experiences, right? So they're at a birthday party, they're speaking Spanish, what's being served there? Rice and beans. And you're at a birthday party, and everybody's speaking English, what are they serving? Hamburgers and hot dogs. They didn't say brisket. One more question? Yes. We do the same thing in English, right? Yeah, that's a really hard question. It's the same question like how do you move from the science of something to implementation, right? It takes a long time, like average of 17 years, some people say 20 years, to move from knowing something in the scientific world for a small proportion of those things being moved into practice. I was talking to somebody recently, and she studies, among other things, hand washing. You know that you're supposed to wash your hands in hospitals. Well, she says the compliance for that is like really low. So if hand washing compliance is really low for doctors, then for speech pathologists, maybe, or for people who are using standardized testing, it's probably not a surprise that we're not on top of our tests. I think that you want to take a couple of approaches. One, some of the test development companies have been really responsive when papers are written about how poorly their tests work. That's the reality. But Pearson, for example, they published a translated version of the preschool language scale that is a widely used scale. It was just translated, and Lytha Restrepo did a really nice study showing how they completely messed up item difficulty. Then they called her and said, "Can you help us consult on the next version of our test?" That's a good thing. And so, I think we can move forward that way. I think the other thing we need to do is to educate ourselves of what are the best practices and what's the framework for selecting tests. In English, we see the same thing. I think it's Elena Plant, Tammy Spalding, and Farinella did a study reviewing the 43 language tests that we use in speech pathology, and of those 43, I think there's only 5 that meet good sensitivity and specificity standards. That makes it easy in terms of choosing accurate tools because there's not too many to choose from, but we have to learn to kind of delineate, which ones are the really good ones and which ones don't do the job very well. And I think that notion is fairly new in the field. So I think that we have to be working at, the test development level and at the educational level. And, I always tell my students, I want you to go at, I'm trying to inoculate you while you're in school so that you don't go out and do all the stupid stuff that we see, going on in the field sometimes. Not that we do stupid stuff, but sometimes we do. So, my goal is to have people understand some of those issues so that you can get out there and educate other people and get on those panels where you have the power to make decisions about what to select and what reason to select those measures. So, keep doing your job and be subversive. Thank you.
Love the Longhorn. She's very cute. A little scary, but very cute. Thank you so much for that wonderful presentation. That was, for me, very enjoyable, as I'm sure for the rest of you out in the room. I now have the additional distinct pleasure to introduce Dr. Carol Schaffner-Hammer. And like I said, I get to introduce two of my academic sheroes, and so she is the next. We're so thrilled that both of you are here with us to share your expertise. And so I'll tell you a little bit about Dr. Hammer's research. So she, in her work, addresses four interrelated areas that focus on young children's school readiness and academic outcomes. These include trajectories of children's language and literacy development, environmental and cultural influences on children's development, assessment of children's language abilities, and finally, interventions that promote children's language and literacy development. She has a particular interest in bilingual children and children from diverse socio-cultural backgrounds, which is why she is one of our speakers today, as that is a topic that we are most interested in talking about. And then also she is another point that is for academics sort of a point of pride and someone that I consider a mentor from afar. She's been continuously funded, which we know is really hard to do, since 2000 by several of the big agencies that are funding some of this important work that we're hearing about. So National Institutes of Health, Institute of Education Sciences, Office of Planning, Research, and Evaluation. And she is visiting us from her recently, recent new home at Teachers College. So welcome. Yeah.
Can you hear me in the back? No. Okay. Can you hear me now? Just like the Verizon commercial, right? So anyway, well, thank you very much, Millie, for your introduction, and Laura for inviting me, and thank you all for coming. This has been a really great experience. I think it's such a nice model to bring together researchers, practitioners, and policymakers. So I am talking to you at a slightly different topic. We're going to talk more about educating DLLs and kind of taking some things from research to policy and practice. So let me see. Sorry, I'm not a PC user, and so sometimes I get confused. There we go. I did. Apologize for that. I feel inept when I'm using a PC. But anyway, we always kind of feel like when we start presentations, we need to kind of give you the demographics, and I know you've already heard these, so I'm going to go through these kind of quickly. But we really do have increasing numbers of dual language learners in the U.S. in the educational system. There's about 11 million children in school-age populations, and in preschool, our best numbers probably come from Head Start, where 30% of the children are dual language learners, with about 80% speaking Spanish. And unfortunately, what we do know is that they're at risk for less than optimal outcomes. So what we see is dual language learners enter Head Start or enter preschool below monolingual norms, and it's unfair to compare them to monolingual norms, but that's what happens when they enter into school. And they leave preschool usually below, and then so they enter kindergarten below, and then what we see is in 4th and 8th and 12th grade, they're also falling below monolingual white, particularly white middle class, their white middle class peers. And also they're more likely to drop out of school, which is certainly a problem. And there's lots of reasons for this, and unfortunately I think most of the time, and I'm not talking about you here in the in the room is that people think it's because the kids are bilingual. But I don't think that's the case. I think that well, I know that there's a high correlation between poverty and being bilingual in the US, and so poverty has a big impact here. The other thing is that we are not doing well as a country of really supporting the children educationally. And I think we would have much better outcomes if we were able to provide them with the supports that they need. So my purpose of the talk and what I was asked to talk about, which I'm more than happy to talk about, is kind of ultimately getting to what are some of the key features. What do we need to be doing to support dual language learners? So I'm going to spend just a few minutes reviewing some kind of highlights about what we know about dual language learners and a little bit about how that might affect our practice. Talk a little bit about bilingual educational models. And then also, I want to share with you some data. Being a researcher, we always have to show you data. But what seems to be happening in many classrooms in different parts of the country, and what is it that we really want to see happening in schools, and then talk about some recommendations. It's not a comprehensive list because there would be this huge list that would go on for days. But anyway, so who are DLLs and what do we know? So just to remind you that we're really talking about children that are exposed to two languages at home and/or at school. And that what we really find is that there are differences, of course, based on age of exposure to their second language, assuming they come with their home language, and the amount of exposure they have in the usage that the children actually have really impacts their development. And so what makes studying and teaching bilingual children so difficult is that there's a whole range of experiences here. It's really hard to find a group of bilingual kids that are all kind of the same. So Liz kind of reviewed what the top languages are in the US, and then looking at Ohio, I found it really interesting because I admit I don't know much about the dual language learner population here, but Spanish is the majority, not the majority, but the largest number, followed by Somali, Arabic, and then Chinese. And yesterday it was revealed there's over 100 languages in Ohio, and what a challenge that all of you have and to address all of these needs. One thing that I do want to remind you is what we have now is we're moving towards the term dual language learner, which I love because it really is recognizing that children are learning two languages and not just English. Now, US Department of Ed is still using English language learner. Dual language learner really came out of the Head Start policy, and Head Start really is seeming to push us in the right direction. But a lot of times when we say ELLs or DLLs, these are becoming overlapping terms for children who are classified by some standard as not being English proficient. And so sometimes these standards are very low, and you really don't need to know much English to really be considered English proficient. And it varies by state, it varies by district, and so you can be English language, you can be an ELL in one district and not another. And so what I want to remind us all is not to forget about those kids who are not labeled as an ELL by school districts, because if you're exposed to two languages, your language learning environment and your language process is different. Not that the trajectory is necessarily different, but there's just differences in their development, and we can't even compare the children who are exposed to both languages at home to monolinguals. They're different. So what we know about DLLs in addition here is that learning two languages is commonplace. More than 60% of the world is actually bilingual, and as you all know, we kind of look at bilingualism and multilingualism as a strange thing in the US, and actually we're the strange people, right? You all know the linguistics joke of, what do you call someone who speaks more than one language? Multilingual. What do you call someone that speaks two languages? Bilingual. And what do you call someone that speaks one language? American, right? And so we're getting there, and hopefully our kids will help us get there. But these next 2 points I'm going to kind of highlight more on the next slide, but as I mentioned, age of exposure is very critical, and the amount of exposure, because there's really a correlation between how much exposure you have in a language and how well you're doing in that language. Rule of thumb is that it takes DLLs 2 to 3 years to catch up to monolinguals conversationally, and 5 to 7 years to catch up to monolinguals in academic language. And so we often forget about that amount of time, and sometimes we're just thinking, oh, I talked to this child and he's doing just fine, but we're talking about something in conversation, the here and now, and so they look like they're really proficient, but academic language is much more difficult. The syntaxes and the grammar is more complex, the vocabulary is more complex, and so kids are struggling. And one of the things that always frustrates me when we put children in English immersion classes is that they, one, don't know the content because they're children and they're learning, and two, they don't know the language. And so we guarantee that they're going to be behind because we're not actually teaching them the content they need to know in the language that they're strongest in. So let me just show you, to give you an example of the importance of exposure. So just to orient you, can you hear me okay in the back? Okay, thank you. So this is looking at Peabody Picture Vocabulary scores. So this is receptive language. And this is from a longitudinal study that we did. So these are essentially fall and spring test scores. And these children went to 2 years in Head Start, and I think that's an important point. So they had 2 years in Head Start, and they went to Head Starts that were English-only Head Starts. These are standard scores. Just to remind you, on standard scores, 100 is the mean, the average. And this green line here is kind of the low end of the typical range. Okay, so everyone's not going to be right at average. So our red line here are children that weren't exposed to English until they started in Head Start at around 3.5 years of age. The blue line is actually children who had been exposed to both Spanish and English at home. And so they had 3.5 years of exposure to English, but you can see our sequential kids, so those kids that were just learning English, are really scoring low, but they're at 60. They're more than 2 standard deviations below the mean. And look, though, our kids that really had been exposed to English still are below that monolingual norm. And as we follow them, it's not until the end of Head Start that our simultaneous learners have kind of gotten to the low end of normal for monolinguals. When I say this is the typical range for monolinguals. And then our kids that didn't get to know or weren't exposed to English until Head Start, it's not until the beginning of first grade that they're at the low end of the monolingual norms. And what I didn't want to do was overwhelm you with data slides, but I have, looking at their expressive vocabulary, they're not doing as well in the expressive, so both groups are even taking longer just in vocabulary. So we need to remember that kids need time to catch up. Sorry, going the wrong direction. So what we do know also is that the home language is not harmful to learning English. That's often a myth, and that's a lot of our policy is let's get them English as quickly as possible and kind of extinguish the language. But I love an analogy that Annika Hauer, who's an internationally known researcher, talks about. Her analogy is, just because I played the piano doesn't mean I can't play the guitar too. And I love thinking about that in terms of language. Just because a child speaks another language at home other than English doesn't mean they can't learn English and keep that language. If you start your child on piano and they changed it and they add guitar, you don't say, oh, we're not going to play the piano anymore, because they have a lot of knowledge about music that they can just transfer over to playing guitar. And that's the same thing that children have when they have a strong home language background. When they start learning English, they don't have to learn how to use language. They know how to make requests. They know how to make statements. They know how to ask for information. They know a lot that they take. So it's not like they're starting from scratch again. So by promoting their home language, that's just helping them with their English language knowledge. And also we do have some evidence from some studies that we have done, as well as a few other researchers have done. But what we did is we looked at what moms were saying what languages they were using with their children at home, and we collected that information each year in kindergarten, in Head Start and then in kindergarten. And we looked at how that affected the development of children's language and their emergent literacy in English. There wasn't a good measure for Spanish, so we weren't able to do it at that time. But what we really found is for moms that were staying using mostly Spanish to all Spanish, that was obviously promoting, and their children were growing faster in their vocabulary in Spanish than moms who were using English, not surprisingly. But there was no effect on the rate of growth on the children's English scores. So that children who were exposed to Spanish had the same growth rate of English as children who were being exposed to more English at home. Now, when we looked at English language usage, so those moms who were using more English, that actually wasn't affecting children's growth either. So they had the same trajectories. And their growth in Spanish was slower. So kind of the bottom line there is that we were thinking that because these children were immersed in English-only classrooms, that they were getting a lot of English at home, at school. So having more English at home wasn't necessarily helping their English. So a good thing to say, we don't have to tell mom to give up her home language or dad to give up his home language. The other thing we did is we looked at their growth of Spanish and English language during Head Start and how that related to their kindergarten and first grade outcomes in reading. And what we found is those children that were growing in Spanish and growing in English, their growth in those two languages separately were actually predicting both Spanish and English reading in kindergarten and first grade. So that even having good growth in Spanish was really very positive for even their English literacy. And part of the thought is if you have a good language system, that language is the foundation for reading. And if you don't understand what you're reading, you're not really going to grow in terms of your abilities. So the other thing, and I think most of you probably would agree and know this, but the importance of home languages is just so critical, that language, communication, and culture are your identity. And so if we're not supporting a child's home language, we're not supporting their identity and their culture. And it is just so critical. The other thing is that a lot of children, when they lose their home language, aren't able to maintain the relationships with their family members. We have kids in Head Start who have stopped refusing to talk to their parents in Spanish, and their parents don't understand English, and so the communication is just really, really impacted. Plus, there is evidence, not a lot of evidence yet, but there's evidence that teachers who are actually using some of the child's home language have better relationships with those DLLs, and that the children's social emotional development is also kind of maximized in those classrooms. And of course, and I think this is often good for policymakers, is that there are great economic benefits for knowing two languages. You're going to more likely get a job and be paid higher. And so that you're off unemployment, which is actually very good for all of us. So let's talk a little bit about some bilingual educational models. So there's different terms for these, and I'm not going to go through all of them, but there are dual language programs, two-way immersion programs, and those are really growing in a lot of popularity. You'll hear about them a little bit later, but that's where children essentially are schooled in one language, perhaps one day, and the second language the other day, and half the children often are native speakers, for example, in Spanish, half the children are native speakers of English, and then the goal is that all children end up being bilingual. Developmental bilingual, or called late exit, is where children are schooled in their native language for the most part for a number of years, and it could be 5 to 7 years and even into high school, and then gradually transitioned out. Transitional bilingual is where there's really an early exit, so they may only have 1 year of instruction in their home language and then moved on. And then we have English immersion. And English immersion is simply, obviously, putting the kids in English classrooms. And I almost hate giving the term English immersion because that actually sounds like somebody's systematically doing something for the children. And they're really not. They plop them in a classroom and give them no supports. And so I would love to see, if we're going to have English immersion, let's support the children's home language. And what we know more about better models in school-age populations. And what we do know is that DLLs do better in bilingual programs than they do in English-only programs. And of those bilingual programs, they do best in either dual immersion or in the late exit. And so those are their best models, them being in early exit or in the immersion programs. Sorry, my throat's dry now. In terms of preschool, we really don't know very much at all. There's not much research out there, which is amazing. We've had bilingual kids in this country since the beginning, right? And we don't know much. And so what we found, some colleagues and I, Virginia Bicey led this effort. We did a critical review of the literature from 2000 to 2011 on educating preschoolers in 2 languages. Now, this was looking at classroom-based, not real specific kind of book reading interventions, but we only found 25 studies over an 11-year period. So that's less than 2 studies a year. And so it was really hard to come to any strong conclusions about anything because some of these were nationally based, very global studies of Head Start down to some real specific studies. But what we do know is that DLLs benefit from preschool, and that incorporating the home language is definitely beneficial for them. But as I said, we really can't make strong conclusions. There are a few studies out there, just a few, that have found that bilingual children, DLLs, that are educated in 2-way immersion programs or even a transitional program. Lillian Duran and her colleagues had a program where kids really only over 1 to 2 years had Spanish instruction and then were transitioned out, but those kids do better in terms of their home language development and literacy development than kids in English immersion because, of course, the home language isn't supported. And their English skills there was no detriment to their English skills. They performed as well as kids that were in English-only classrooms. So we need to get this news out there so that we can change the policies that we don't need to have English-only classrooms. So the situation is obviously very complicated. That's why we're all here and we're trying to figure it out. And there's a whole range of options, of course, here in terms of complications. So you have some classrooms where there's really only one home language, like Spanish, and that's actually in some ways the easier solution or the easier situation. And then I think what's really probably happening in a lot of classrooms in Ohio is that you've got lots of different languages and so you can't pick one second language for the children, and that really makes it complicated. And we really haven't spent a lot of time looking at those classrooms where there are multiple languages. What also complicates this is that most teachers are monolingual. And so how do we deal with monolingual teachers who can't speak the child's language, of course? And we have assistants in classrooms that are more likely to speak the child's home language, but in the programs where I am, they're typically not allowed to speak in that child's language, not encouraged to, and tend to be doing the helpers and doing the teeth brushing and the hand washing and getting set up. And we've got this wonderful resource in classrooms that's not being capitalized on. And we also have state and district policies and sometimes even building level policies that are English only. And as you know, there are a few states out there that have kind of really banned bilingual instruction. And as I've alluded to before, children really don't get the support they need for English language development. So let's talk about classrooms. I'm going to share what I find to be a little bit depressing information, but then we can kind of talk about what needs to happen and what can happen. So one thing in terms of the state of teacher education is that in many states, teachers are not given training on dual language learners, and I use the acronym CLD, culturally and linguistically diverse children. It's only about a third of the states that require this. So how do we expect teachers to help children that they haven't been trained to help? And so this affects their beliefs and practices because a lot of the knowledge that they have about DLLs and culturally diverse children comes kind of from the mainstream and their own personal experiences. So this is results of a very recent study that came out that involved 425 elementary school teachers in southwestern Florida. And 71% of the teachers, these are elementary school teachers, were white. And what really is depressing, just was a basic survey, but 75% of the teachers agreed with the following statements. It is unreasonable to expect a regular classroom teacher to teach a student who does not speak English. They also thought that most non- or limited English proficient students are not motivated to learn English, which I have never seen a child who's not motivated to learn. Having a non- or limited English proficient student in the classroom is detrimental to the learning of other students. And too much time and energy is spent being placed on multiculturalism in schools and communities. That is just really frightening. My group of researcher friends, this article was going out all over. And about 80%, I believe, didn't support any additional funding for teaching dual language learners. And that is just very sad to me. And so these beliefs will also impact practices. Now, I will tell you on the positive side, we were doing research in that general area as well with Head Start teachers, but many of them were Latina. They had very different views of bilingual kids. But I just want to share with you what's going on in some classrooms. And these classrooms, I realize, are not nationally representative, but I've been in lots of classrooms, and this is kind of what I see in these classrooms. And please, language. So in our Tools of the Mind study, so this is from a study where we are doing a randomized controlled trial of tools of the mind in classrooms where there are DLLs, between 20 and 100% Spanish-speaking DLLs. So this is in 63 classrooms. And we have well-educated teachers. They average 13 years of experience. Almost half of them had a master's degree. And about 2/3 of them spoke Spanish, reported speaking Spanish well or very well. And we did the CLAS, which is a quality rating measure. And what's important to know about that is that they were solid classrooms. They were scoring around the national averages for classroom quality. And what we did is we used this measure called the LISTEN. That really doesn't matter. But what we did is we took 4 kids from each classroom and followed them around for the morning. This did not include recess or any music time or any specials that may occur, but this was all instruction time in classrooms. And so we were finding what's going on with the language that these kids are experiencing. So this is really depressing to me. We'll start on the better side, I guess. So what blue is meaning the kid's not talking to anybody. And green is English, and then red is Spanish. And so 30% of the time, what's good is that the kids were talking to another child. In order to learn language, you have to use language. And if you don't use it, it's harder to learn. What's really depressing, following individual children, so these were about 240 kids that we followed around, 94% of the time, because the teacher's got 30 kids in the classroom, this child isn't talking to the teacher. Only 5% of the time were they talking to the teacher. So there's not a lot of good quality time for kids talking. Something else that's really important is extended talk, so having conversations. And in this measure, what we defined a conversation was the child had 2 conversational turns and the teacher had 2 conversational turns. This is essentially saying no conversation. This is almost 90% of the time, no conversations. Just like less than 5% had an extended conversation with a teacher or a peer. So, but I think that really is what goes on in many classrooms. Now, because language is the foundation, to me, I know I'm a speech pathologist, and there's lots of areas of important things, but language is the foundation. That's how we communicate, that's how we learn. And so the other thing that this did, what we did is document what are teachers spending time on. And we're documenting every 30 seconds, okay? So I'm not saying this is necessarily bad, but other meant like probably transitioning, or maybe this was all class time. I'm not exactly sure what they were doing in other, but almost 60% of the time was in fine motor or gross motor. I'm not saying fine motor and gross motor is unimportant at all, but what I'm concerned about is building language for children. So this non-print is oral language. So only 6% of the time were teachers engaged in oral language. And oral language supports is broadly defined. Sounds was less than 2% of the time, and that includes phonological awareness. And phonological awareness is one of those key things that we really need to be working on to help children learn to read. In terms of looking at quality of language support, so I've kind of reduced these down. I put numbers in red and black. Red is not really where we want them to be, and these red numbers, for those of you in the back that might not be able to see, it's at least half, it's 50% to 80%, essentially. In most of these is where the teachers were not doing some of these key language supports. So effectively using pictures and objects to teach, to help with comprehension and teaching new concepts. Repeating information in simple sentences. For DLLs, what we often do is we talk in very long, complicated sentences, even for children. And so DLLs, if we say, after you're finished brushing your teeth, I want you to go get your shoes. That's a lot for DLL. That's complex grammar. And so what we need to do is we need to expose them to higher level language, but then we also need to break it down for them and repeat it in simple sentences. Elaborating on what the child has said. Most of the teachers, this is really saying minimally or not at all, were not doing, these were more global ratings here. Asking questions that can be answered with a single word. And that, so 66% of the time, or 66% of the teachers were really, that was something they did a lot, is asking closed-ended questions. And it's really hard, actually, to be asking a lot of open-ended questions, but a closed-ended question is a question that you can answer essentially with one word or two words, and you don't have to put a sentence together. So I can say to a child, how do you think the little boy felt when the little girl took his cookie away? Sounds like a really complex question, right? And it is a how question. That is a little harder question, and the syntax is a little bit. But do I need to answer that question with a sentence? No, right? I can say sad, right? Mad. And so, and what we don't want children to do is we don't want to say to children, answer in a complete sentence, because we don't all answer in a complete sentence. So if I ask you all, what is this? You're going to say cup or glass, but you're not going to say it is a cup or it is a glass. Because it's not pragmatically appropriate to do that. So we need to be asking children open-ended questions like, what's happening? Or giving them prompt, tell me more, so that they have an opportunity to put together sentences and use that language. The other thing is that actually you'll see in a moment, book reading didn't happen very frequently in classrooms, and book reading is so important. It's such a language-rich time. Talking meaningfully to children about the books was also not happening in most of the classrooms. What also we really want to have happening is vocabulary instruction. And so looking at classrooms that were intentionally teaching more sophisticated words, so really teaching vocabulary words, 84% of the classrooms were not working on vocabulary. Intentionally teaching basic concepts, about half, and then teaching vocabulary prior to reading books. Because books, if you choose the right books, have wonderful vocabulary that you can use and pull out, but 94% of the teachers were not linking book reading to vocabulary. And so that is just such a rich area. Time spent reading books, what you can see here is less than 6% of the time, where 6% of the classrooms read 5 to 10 minutes to children in Spanish, and 16% read 5 to 10 minutes in English. And the rest is not even reading 5 and even not reading at all. And what we really know is the importance of book reading. And what's really happening, I think, is teachers are being given more and more things that they need to do in the classroom. And book reading is kind of being viewed as something superficial and something nice to do. And so it's really hard to get more and more book reading in. So let's talk about some best practices here. So what is ideal, of course, is bilingual programming for children. Ideally, a dual immersion program. And what really seems to be catching on, which is great in the US, is many middle class and upper middle class parents want their children to be bilingual. And so that's where I think we have to go. We need to sell dual immersion for those parents' children, and then we bring in our dual language learners who are the native speakers. And that, I think, will get us more buy-in, because everyone is more interested, understandably, of their child than other people's children. And I'm hopeful that we can kind of leverage this with legislators and policymakers. And we also need to really be providing ongoing professional development for teachers, because we know that many teachers haven't been trained. And many teachers also really haven't been trained on how to support language development for monolingual children as well as bilingual children. And one-time professional development, one-time PD is not enough. What the research really shows is that you need continual follow-up and coaching to help teachers implement things in their classrooms. So some of my suggestions here and what we need to do for DLLs, this can be done in their home language or it can be done in English. So if one speaks 2 languages, you can implement these in both languages, but for monolingual teachers, they can still really give good supports for dual language learners. So easy things like using gestures and props and pictures and photos to give a context and background knowledge for the children. And I'm going to expand on that in just a second. But that will help support comprehension, particularly when introducing new vocabulary and concepts. The other thing that I rarely see happening in classrooms is building on the children's background knowledge from children from diverse cultural backgrounds. They come with a lot, funds of knowledge. They come with cultural knowledge. It may not be what the typical preschool curriculum is. And so what do? We dump them in the preschool or the school, we teach them in English, and then we teach them content that they have no foundation for. Now, that doesn't mean they don't understand and have foundation, of course, in many things in classrooms. But if we could be teaching children, bring in aspects of their culture, it will engage them more, but it will also help them a lot. So one thing that I always hate to admit, but I'm a struggling bilingual. I've been working on being bilingual for a long time, and I haven't gotten there yet. And being an academic, I don't have a lot of time either. But just to give you an idea, I try and work on my Spanish, and so sometimes I will read El País, which is the paper of Spain. And it's kind of like the New York Times version, very complex sentences and syntax. I understand so much better the articles when I'm reading something about the US context, because I have knowledge of the US context. And it's like, boy, I can really understand Spanish. And then I change and I go over to something that's written about Europe or about Spain. And I don't know as much about Spain, even though I love Spain. I love Barcelona, but I don't know as much about, and that article is so difficult for me. And that's what our children are going through when we give them all new content and we give them all new language. We kind of need to help them. And what we have is we have great opportunities a lot of times through classroom assistance if the teacher is not from the child's culture, parents and community leaders. And there are ways of engaging individuals, and unfortunately that's kind of another talk, and we could talk more about that if you'd like, but ways of pulling in parents and allowing assistance and promoting assistance, allowing them to use that home language for instruction. I'm always amazed. We're working in a large district, and I won't identify it in the Northeast, and there are many different languages. Spanish is the largest one, but nobody does anything to help transition the children even into school on the first day. Why can't someone talk to the child in their home language? I can't imagine how difficult. Well, I can imagine how difficult, but as a little child, it has to be so hard. So we want to build on their cultural and funds of knowledge. There's really nice ways of doing that. But when we're bringing in this new content, a lot of times what we do is we show them a book or we'll show them a photo, but we're not really building experiences with that knowledge. And you know, if you haven't experienced something, there's not a lot that, it's a lot harder. So, you know, in this day and age, we have lots of YouTube videos and lots of ways that we can show what if we're talking about going, you know, the firehouse, we can show videos of this to build that rather than showing them this is the fire truck with this little, you know, model of that. But taking time to talk about the content and let the children experience it. One of the things that Tools of the Mind does that I really do like is they practice. Like if we're going to have the housekeeping area become the firehouse, they actually practice with the children. This is what the fireman may say. This is what the person, and they kind of practice the roles rather than just saying, go off and play in the firehouse. I mean, how many kids really know what goes on in the firehouse? Working with dual language learners in small groups is really beneficial because you can tailor that. Now that's kind of obvious, but it doesn't happen a lot, and obviously small groups are best for all children, but this way we can tailor the language supports that they need. And of course, whenever possible, teaching them something in their home language before exposing them to it in English, or even at some point in the day is really very helpful because that builds their background knowledge. So a lot of times, of course, we're reading books in English, has complex syntax, maybe a topic that the kids never have known, maybe not really culturally salient for the children, and they have no idea what's going on. But why not take time when the kids arrive in the morning and read the book to them in Spanish or in their home language? Now I realize some of you are going to say, but I can't read the book to them in home language. What we've been doing is we have made for another project that we have selected choice books in high quality literature for the teachers to use. And so what we've done is we have a native Spanish speaker that has read all the books onto a DVD. So I'm really dating myself for those of you that remember the little, oh no, what were they called? Where you would listen to something, you get the little dink, the film strips that we would do, and you know you're supposed to change the page. That's what we did. We put these on CDs for the teachers, and then they can kind of go off in the listening station, so at least the kids have heard. And so what if they're really not on the right page? It would be nice, but at least they've heard the story. And so there's ways of engaging assistants and parents, even if the book is not in Somali, because I'm assuming there's not a lot there, even if someone is paraphrasing the book for the child, they've heard what the message of the book is, and then they have something to map onto once they hear it in English. So just really encouraging that we are instructing in both languages whenever possible. And building high quality vocabulary. Vocabulary, if you're talking about vocabulary, all the rich language comes around it if you've planned your vocabulary instruction. So we really need to intentionally teach vocabulary. And if there's a way of making connections to what kids know in their home language is really very helpful, because the child, for example, knows gato, knows cat, right? When they now learn the cat is gato in English, they don't have to relearn about cats all over again. They know about cats, they just don't know that word. And so if we can make the links between those vocabulary words in their home language and English would be wonderful. Reading books to children, as I've said, targeting vocabulary, but multiple exposures to books, because kids don't get those books the first time. And so there's literature out there that says that reading a book more than once, we get tired of it as adults. So like, I've heard this story a million times, I've read it, but kids love it and they benefit from it too. And engaging in conversations about books. As I've kind of alluded to when I was showing what was going on in classrooms, is asking open-ended questions. So for those of you that are teachers, I'm going to give you an assignment. Go and, when you're teaching tomorrow, or no, I guess you're not teaching tomorrow, next week, Just kind of do a little, if you can videotape yourself, take your phone and just record yourself, but think about how many times you're asking yes/no questions, or how many times you're asking questions like, what is this? What is he doing? Those close-ended questions. And thinking about maybe even taking a time during the day where you're starting to ask and really thinking more about open-ended questions. And sometimes it's really helpful to plan those questions ahead of time, particularly in the beginning when really thinking about this. Modeling language for children. So a lot of dual language learners that really don't know English, you'll ask them a question and they look at you, of course, because they probably may not know the answer or how to express it in English. So one thing that you can also do is model a response for a child as if that child were responding. So if the child doesn't speak English, I'm not going to model a 7-word response, but I will model a 2 to 3 word response, a complete sentence, so the child can kind of hear what the response might be. So if you ask the child, kind of moving on to expanding utterances, and so sometimes children will just say, you ask them, what is this? And they say truck. Now that was a nice close-ended question, wasn't it? But we can expand on this. Oh, you see a green truck. You can kind of build on to what they're doing. So you're just a little bit ahead of the kids without giving them these really long utterances for them to try and repeat back. And again, engaging kids in sustained conversations and engaging them in storytelling. So one of the things that we did is we developed a series of books that were in Spanish that really, we developed these with parents. And so we developed a series of 8 books for this book reading intervention about a family going home to their home country and experiencing festivals and just different cultural kind of values throughout the time. But then what we did, and we had them illustrated, but then we copied the illustrations and we had the kids make their own book. And so then the kids really liked these books, but then what they could do is they had a little portable book that they could take along with them, and they would tell stories to their family members or teachers, and so they were practicing their narrative abilities. Narrative abilities, storytelling, is predictive of reading, and so narrative telling is really good. All right, so I have a few minutes, I think, and so I have a few slides, and I think I can do this in those few minutes. So it's really easy to say, what do we need to do research? We need to do research on everything. We have to investigate different models of bilingual education. We need evidence for this. Why do things that we don't have, we have to do something while we're waiting for the evidence, but why do things that aren't effective? So like, I hope you all know, like Project DARE, the anti-drug program, shows no effects. But DARE is still out there. Why are we spending money on DARE? I'm not quite sure. So that's the same thing in education. And we need to understand what teaching strategies and how to use the 2 languages in classrooms, or what strategies. We don't have evidence for that. And we have to figure out what works for what children, because not one model isn't going to work for everybody. And we need to develop and test professional development programs for teachers and training of coaches as well. In terms of policy, we need so this is like US and state level policies, but we need comprehensive policies for DLLs and ELLs, and I've specifically divided those out because we don't want to forget about the kids who aren't classified, and support the home language as well as English. And there's some really nice things going on. So the new performance standards for Head Start is mandating, hopefully, they're still in the discussion stage right now, is that Head Start teachers will be responsible for making sure home language develops as well as English, which I think is really going to have some nice impacts on things. And actually the state of Minnesota, they don't know how they're doing this yet, has passed a law that children need to be educated in their home language. It's really very revolutionary, and actually I'm going to Minnesota on Friday, so hopefully I'm going to find out how they're doing. I heard about this, it was just like about a year ago that they passed this. Sorry, I forgot where I was going here, but bilingual, it would be so great if we got more support for dual language programs. And what we need to get across to policymakers, and I'm sure the policymakers that are here in the room are already, on our side, but we cannot not support dual language learners. if they're not well educated, they're not going to graduate from school. They're going to end up on the unemployment rolls. Unfortunately, some will end up in prisons. It's going to cost us more money. So if we invest now, we're going to be saving money. And that's for some reason that hasn't dawned on people, but I don't understand why we don't want to invest in the children. We cannot not. One of the things I was reminding myself with the ECLS case study, don't worry about what it is, but it was a nationally representative sample looking at dual language learner children and how they did based on their English proficiency going into kindergarten. And those children, those dual language learners that were proficient in English by kindergarten, their growth in reading mirrored the monolinguals. But those kids who were less and less proficient in English when they started kindergarten had drastically different trajectories than those that were proficient. And we need high quality childcare. As you know, there's a big push for universal pre-K around the country. New York just passed a universal pre-K, so they just added 70,000 kids to pre-K in the fall. And they need teachers that are well trained, but we need high quality. It's just not enough. So a recent study just came out that was really showing that preschool doesn't always matter if it's not high quality, and so we need high quality. And also longer. There's a nice EduCare study that came out that was on 1,000 kids in EduCare, which is a model, but what is really important is even though the kids weren't necessarily, the dual language learners weren't necessarily educated in their home language, they still maintain their home language, and those kids who started in high quality childcare early on that were dual language learners were doing very well and they were doing better than children who had been in childcare for less time. And we need pre-service and ongoing in-service for teachers, all teachers, pre-service and in-service, and we need funds in order to support that, and we need state mandates that are requiring that teachers receive this training. So real quickly on practice, so there's some overlap. Provide dual language programming and link the bilingual program with the ECE program. In the districts that I have been in, and so it's not 100, all of the districts out there, the bilingual program, sometimes you see wonderful bilingual programs in school age, but school age and preschool don't talk. And so I was in a district in Texas, not in the area where Liz is, but in another part, wonderful bilingual programs at school age, but they had Spanish-speaking teachers who taught all in English in pre-K, and ECE and bilingual programs were not talking at all. Teachers, one point that I didn't make is we really need to understand the language experiences that the kids come to the classroom with, more than what's the home language on the little form that parents fill out at the beginning of the year. We need to really understand when was the child first exposed to Spanish and English. Sorry, that's my default language to be using as an example. When and how much? And has this changed over time? When did the child go into childcare? Is this child new? That will give us so much more information. And as Liz was kind of alluding to, we need that information to figure out whether or not a child is having difficulty or not. We need to know their background. Promoting home language usage, providing high quality instruction, and as I said, using the assistants, community people, and parents to help us. And we really can get them into classrooms or even giving us consultations, even if they're not coming into classroom, to help get the language and the culture into classrooms. So thank you. Do you want me to take one question? Sure.
This may be more appropriate for the panel, but you mentioned multiple times we have the evidence, research is clear. After say, yeah, well, we know that it isn't about empirical evidence. It's about ideologies.
Yeah.
What's shaping policies. So do you want to speak to that in any way, or leave that for the panel?
I'll certainly let the panel address it, but I think there's kind of two things. I think it's the economics of it that are going to move policy and people who are not kind of in our choir like in Philadelphia, which is actually where I live, in Philadelphia, they've just said they want to do universal pre-K, and they don't quite know how to do that. But the police commissioner and police commissioners around the country are actually supporting universal pre-K because they know education is important and that it reduces crime in the future. And so talking about the economics, and so with bilinguals and supporting bilinguals, we have the same issue. So using the economics, I think, and prisons and more people on welfare systems is one way. It's not, it's not the panacea. And then, like I said, getting the programs, getting middle-class parents who really want them to see the value of having actual Spanish speakers or Somali speakers in their classrooms. All right. Thank you. Yeah.
Thank you. Incredibly interesting and great fodder for the panel. Now, you can leave this room, but you can't leave this building because we're going to take a 15-minute break, and I think there's still snacks and drinks around. We'll convene back here at about 3, and we have an esteemed panel who will address these conversational topics, and then also we can have a question and answer dialogue. And we do have a reception from 4 till 5. And so if you didn't eat enough at lunch, we're going to have really nice hors d'oeuvres and some cocktails to celebrate the closing of our symposium. So please come back.